Did you know that your tongue is responsible for more than just tasting your food? Your tongue also plays a part in how you breathe, how you eat, how you talk, your posture, and also how crooked your teeth are. So if you have something called a tongue tie or ankyloglossia, it can really limit the freedom of movement of your tongue and cause all of these problems and more. And this is true whether you're an adult or a child. A tongue tie happens when this attachment underneath your tongue called a lingual frenulum is too short. So normally you have this attachment that connects your tongue to the floor of your mouth. But when this attachment is really short and really tight, then your tongue can't really move so well. A common sign is if you stick your tongue out, you get this V shape in your tongue. So a lot of times if we're born with a tongue tie, then it's clipped by the doctor and it's not really a problem. But sometimes it'll regrow, or sometimes it's completely missed and it's never clipped. So why is this such a big deal? Well, when you have a tongue tie, it makes it harder for your tongue to touch the roof of your mouth. Ideally, your tongue should be resting against the roof of your mouth. Not just the tip of your tongue, but also the middle and back part of your tongue. And also your lips should be closed and your teeth should be slightly touching. This is how your oral posture is supposed to be. This is considered perfect mouth posture. And when your mouth posture is like this from an early age, it leads to a lot better jaw development. Because when your tongue is resting against the roof of your mouth, then the roof of your mouth will grow in the shape of your tongue. Because that constant pressure from your tongue will cause these stem cells in your palate to grow, and they'll grow wider and forward. And when that happens, you'll get this really wide U-shaped palate. And this will make a lot of room for all your teeth to come in the right place, and you won't have that crowding. And also you will have better breathing, because when your tongue is resting against the roof of your mouth, then it is impossible to breathe from your mouth. That means you'll have to breathe from your nose. And breathing through your nose is so much better for you than breathing through your mouth. Now I do make other videos going into more detail, talking about nose breathing versus mouth breathing, so I'm putting a link in the description below where I go more into detail on that. But essentially, when you breathe through your nose, then you're gonna be supplying your body with a lot more oxygen. And this also leads to you having better sleep. So people who have these tongue ties will really struggle keeping their mouth closed, because really the work in keeping your mouth closed, a lot of it's being done by your tongue. When you're keeping your tongue against the roof of your mouth, then it's gonna be a lot easier to keep your mouth closed. But instead, when your tongue is essentially glued to the floor of your mouth, now your jaw is gonna be hanging open all the time. And this is going to turn you into a regular mouth breather. And now when you're sleeping with your mouth hanging open like this, your tongue is going to be more likely to fall back and cut off your breathing. And this is what causes sleep apnea in so many people. Now, if you're already an adult, you probably cannot fix your jaw development, but this proper oral posture still has a lot of other benefits. So we talked a little bit already about the nose breathing and the better sleep, but your tongue posture also plays into your overall posture. So your tongue is connected to your jaw and your neck muscles. So if your jaw is always hanging open and your tongue is always at the floor of your mouth, then this is going to start to pull your head forward. So now you're going to be more likely to have a forward head posture because your head is going to be tilted forward. And there's also some physics behind this. So an average head weighs about 12 pounds. But whenever your head starts tilting forward, then that adds weight to your neck and your shoulders. So every inch that your head falls forward, that adds about 10 pounds to your neck and your shoulders. So if your head is tilted forward 3 inches, now instead of having a 12-pound head, you're essentially having a 42-pound head. Now luckily there is a little exercise you can start doing with your tongue to improve your forward head posture. First, you gotta put your tongue against the roof of your mouth, and not just the tip of your tongue, also the middle and back part of your tongue. And then you're gonna make a really wide smile, and then drop your jaw until your tongue falls from the roof of your mouth. So it's gonna look a little like this. Do this exercise about 20 to 25 times a day and try to do it 2 times a day, and you'll start to give yourself a natural neck lift because you'll be strengthening your tongue and your neck muscles. Now, going back to tongue ties, it can cause some other issues too, especially in newborns and children. So a lot of times a baby will have trouble breastfeeding because they just can't latch. And a lot of times that's because of this tongue tie. Because breastfeeding will force that baby to put its tongue against the roof of its mouth so it can basically suck out the milk. As opposed to out of a sippy cup, that kind of pushes the tongue down and it makes it a lot easier to get that milk out. So breastfeeding will be a lot better for a baby in terms of its jaw development because it'll force that baby to start using its tongue properly. But if a baby has a tongue tie and they can't put their tongue against the roof of their mouth, then they're gonna have a really hard time breastfeeding. Tongue ties can also lead to speech difficulties because if you can't move your tongue in the right position, then it's going to be hard for you to say certain words. So a lot of people who have tongue ties end up in speech therapy. It can also make it harder to swallow because normally your tongue will push that bolus of food to the back of your mouth so that you can swallow it. But if you have a tongue tie, then your tongue is not going to be working properly. Now, if you do have a tongue tie, luckily there is a very simple fix for it, and it's a very simple surgery. But you would have to probably consult with your dentist or your ENT, your ear, nose, and throat doctor, to get it evaluated and get it clipped if you need to. And usually after you get your tongue tie clipped, then it comes with some exercises to do afterwards, these tongue exercises. Now make sure you do these exercises if you get your tongue tie clipped, because if you don't do these tongue tie exercises, then this tongue tie attachment will probably grow back and scar. Now if you're looking in the mirror and you're trying to see if you have a tongue tie or not and see if you need to get a surgery or not, just stop. There's a simple test to see if your tongue tie attachment is too short. I call it the 2-finger test. So put your tongue against the roof of your mouth, and not just the tip of your tongue, the middle and the back part of your tongue too. And then open your mouth as wide as you can while keeping that tongue against the roof of your mouth. If you can fit 2 fingers in your mouth while they are overlapped like this, then you probably are fine and do not need to get your tongue tie clipped. So the test looks a little bit like this. So if you pass this test, that is great, but make sure you still focus on those tongue exercises I mentioned, and also try to practice that proper oral posture at all times. And also the last little tip I have, try only eating with your mouth closed and eating evenly on both the left and the right side of your mouth. And then every time you have to swallow, try only using your tongue to push that bolus of food in the back of your mouth. You'll probably find that it's a little bit harder than you think, especially if you have not been doing this proper oral posture from an early age. Root canals, are they safe or not? There was a movie called Root Cause on Netflix. It ended up getting taken down, most likely because of some sort of information, but it did cause a lot of panic in a lot of people, specifically with root canals. So just some background on the movie. It's about this guy named Bailey